Hi, I'm Dr. Schmidt, naturopath, and what I'm going to discuss is some of the testing that I can offer to help you fine-tune your wellness program. Many of you just don't quite understand why you're not at the level of health or the weight or other things that maybe you're concerned about. An area of testing I do is called dark field microscope. I take a small drop of blood, not much more different than getting blood sugar, and I put it into a very high-powered microscope. I'm able to see the quality of your red blood cells, your plasma, white blood cells, and various minute factors of blood chemistry are revealed visually to help me understand what you're dealing with and how to begin to work to improve your overall health. Another drop of blood is called dark field. Another drop of blood is used on dry blood analysis. The dry blood analysis is useful in identifying such issues as heavy metal or chemical toxicity, inflammation or systemic stress, and other disorders such as glandular or hormonal problems. Also, fungus is an issue that we identify at a level in the dry blood analysis. Now, another area of testing deals with urine and saliva. Two primary things I use first with the urine and saliva deal with a device called quantitative fluid, or also known as biological terrain assessment. These fluids are used into that device and used through a computer program to identify deep tissue, or we call the interstitial fluid or biological terrain of the body. What we're looking for is minute differences that make your organs not work as well as they should, and what we can do to tweak and make your body spin like it's really made to do. You'll feel much younger taking the recommendations that we find necessary to correct the imbalance using the biological terrain assessment. In addition to the BTA, or quantitative fluid analysis, I use urine for additional tests. One test is the adrenal score to see if you're in a sympathetic or parasympathetic overload. The next is a calcium score to see if you're displacing a lot of calcium. Another test is what's called leaky gut or malabsorption test, which can also be identified with other sensitive issues like digestive disorders like gluten or food allergies. Another test deals with nitrates in the urine to show if there's inflammation, and another is an ammonia test. Also look at sugar levels in the urine, which are total all types of sugars, not just blood glucose. So all these tests are put together in combination with each one to kind of cross-check and balance what I'm really looking at and what the most important issue is to address. So come by and get information about this and get tested. Blood analysis is the dry blood analysis, and in that it's how the blood dries indicates certain aspects of the body health. And when we have a lot of white spots, that's a lot of deep tissue inflammation and stress in the body. You know anyone stressed? But work and family can stress. So the biggest issue with this person is a lot of deep tissue stress. So that stress is also burns minerals, and that in turn makes the body more acidic, and that's why the live blood was sticky, is because of oxidation and the pH imbalance. So a lot of minerals to buffer the minerals you're burning through stress, and something to work on the antioxidant side. But the first is the pH, because when you're acidic, you're going to oxidize faster. So antioxidants alone won't get you there. The very slight orange can be a little fungal or candida issue, underlying issue. And the way it kind of has some rings, the lymphatics could be a little better, but so every sample's a little different. Mm-hmm. So this is another client sample and of the dry blood analysis. And the most obvious thing is the rings and waves here, and that's indicating a lymphatic congestion and inability for the lymph nodes to discharge, congestion. And then the darker center area is digestive or colon problems that are more inherent with this person. And then the white spot means there's a lot of inflammation with the gut, and this person has irritable bowel syndrome. So this is something that's confirming that. And then this tight dark edge is indicative of heavy metal and chemical toxicity. So this person lived near a mining area, and that could be the reason why these metals are more prevalent. So we'll work on those issues and the level of microorganisms that convert foods into energy for the cells.
Oh, wow.
So this is blood between two pieces of glass, and
Okay.
then there's oil on both, so it's an oil immersion microscope. And the objective is to see the blood as clearly as it came out of the body and then into this high magnification. These are red blood cells, and which are sticking together. And there's several things that cause blood cells to stick together. One is you're not digesting oils well enough, and then those oils are in the blood. And then when oils also oxidize, so when a table oil like an olive oil or canola oil goes bad, it's rancid, and we can kind of smell that. When we're stressed, we're oxidizing, and that oxidation can make the blood sticky. And then when the blood sticks, then other blood cells stick together, and it reduces your oxygenation. Because when you have individual blood cells, you're going to be better oxygenating at the cellular level. And then we look at the integrity of blood cells across the total sample. If there were many of them that were very odd shaped, there'd be even excessive oxidation or poor assimilation of the building materials necessary to make red blood cells. The little dots are a level of microorganisms. These microorganisms have a regulatory aspect in blood chemistry. But when the pH ranges of blood chemistry are challenged at the high and low ends of pH, these microorganisms will mutate into degenerative microorganisms. And then they'll invade a red blood cell, and when they do, that's why the blood cell has a greater glow. See where there's no glow in this, and there's a very dominant glow in that. Red blood cell's concaved anyway, and it will pick up some light refraction, but when it has a definite twinkle to it, it's a challenge. This is a neutrophil, and a neutrophil's job is to kind of do housekeeping, to go through and clean up things and pick up things. It's got a good 3 to 4 nucleuses are common in a neutrophil, but it should be pushing and shoving and pushing and shoving. The brightness is a good indicator. It's basically like hydrogen peroxide is what it's generating, and it's doing that okay, but it's not as mobile, and the mineral zinc and other trace minerals enable that to function better. If we had excessive oval blood cells, that would be a glandular or hormonal challenge or imbalance. That's another neutrophil. So we would start with a little more mineralization to improve the pH, and then we would also work with enzymes with meals to help digest foods, and that would be an initial start to do that. And then there are some homeopathics that specifically target the other advanced microorganisms to go ahead and. This is undigested. It's sugars and fats that occurs when there's additional digestion problem. But it's all manageable. We're just trying to fine-tune and improve health at the best level.